we are looking at the ATLS primary survey. So here the question we want to ask is, what are the steps in case of the ATLS primary survey? So we'll find out this answer and learn in detail about this topic. So to start with, we need to know what is ATLS. So the ATLS expansion is nothing but the advanced ATLS. You might be knowing this already, but it is the advanced trauma life support. So this is the full form of the ATLS. So to start with the steps it includes a primary survey. So first is the primary survey. So this primary survey with the simultaneous resuscitation, the simultaneous resuscitation, and to identify and treat what is killing the patient. To identify, so you identify and treat what is killing the patient, what is killing the patient. So this is the first one. The second one is nothing but there is secondary survey. There is a secondary survey. So secondary survey is when you proceed to identify all other injuries. You proceed to identify all other injuries. Next, what we have is the definitive care. There is definitive care. So what does this definitive care include? So it develops a definitive management plan. So there's a management plan here. Now, to just recap what we did, we saw the ATLS, that is stands for the Advanced Trauma Life Support. So under the primary survey, it includes, along with the simultaneous resuscitation, so there is the identification and the treatment of what is killing the patient. And then looking at the secondary survey, it proceeds to identify all other injuries. So we find out all other injuries. There is a secondary survey. Next, definitive care is where we have a definitive management plan for the condition. So now we are going to dive deeper. That is first with the primary survey. So under primary survey, there is a beautiful mnemonic, that is the ABCDE. So here the A stands for the airway management. So it is a airway management, and so the airway is assessed and protected. So what we do here is we maintain of the spine stability. Spine stability is done. That is one of the most important. So the spine stability is maintained, and then if the airway obstruction is identified, the jaw thrust in cervical injury patients or chin lift is performed. So some things which are performed are the jaw thrust and the jaw thrust in cervical injury or chin lift. Jaw thrust and chin lift can be performed. So this is done in case of the airway obstruction. Next, we look at breathing. B for breathing. So under breathing, so we also have the ventilation assessment. The ventilation assessment. So it is to maintain the adequate oxygen. So we maintain the oxygenation, and consider a non-invasive or invasive ventilation. So we consider a non-invasive or the invasive ventilation. Next, what we do is we do the circulatory assessment. So circulatory assessment, we do the controlling of the hemorrhage. There is control of the hemorrhage, and we also maintain the volume. So now we'll just recap what we did. So we saw the primary survey. So primary survey, the mnemonic is ABCDE. So A for the airway management. So what do? We maintain the cervical spine stability. So if the airway obstruction is identified, the jaw thrust can be given in case of the cervical injury patients, or the chin lift it can be given. So then B. B for breathing. So under breathing and the ventilation assessment is done. So they maintain adequate oxygenization, as well as we consider a non-invasive or the invasive ventilation. The invasive ventilation when indicated. Then we saw what is C. C is for the circulatory assessment. So what we do here is we control hemorrhage. There is also the maintaining the circulatory volume. So now we'll be continuing the circulatory assessment. So under the C, circulatory assessment, one more thing we do is we also look for the adequate end organ perfusion. There is adequate end organ perfusion, and there is also 2 wide bore. There is a 2 wide bore. So 2 wide bore, it includes 14G to 16G cannulae. So this cannulae, so they are inserted for the intravenous fluid resuscitation. Intravenous fluid resuscitation. Next, we also have the D. D for the disability assessment. D for the disability assessment. So it is to perform a basic neurological evaluation. So a neurological evaluation is done, and that is by the AVPU as well as the GCSP, and the glucose levels and the blood glucose. So these things are done. Then we look at E. What does E stand for? So E is nothing but the exposure with environmental control. There is exposure with the environmental control. So this is to undress the patient, examine thoroughly for possible injuries. So you undress the patient and look for injuries, possible injuries, and prevent the hypothermia. So prevent the hypothermia. So just to recap what we did, we were left out with the C. So C was basically the circulation assessment. So we have to control the hemorrhage, and another thing we had to do was we had to maintain the circulatory volume, and other point which we left out was adequate end organ perfusion. Now other thing is the 2 wide bore, that is 14 to 16 gauge cannula are inserted in the IV fluid resuscitation. Then when we move on to D, D is nothing but the disability assessment. It is the disability assessment. So we perform a basic neurological evaluation, that is by AVPU and the GCSP, as well as there is a blood glucose level is estimated. Then we have E. E is for the exposure as well as the environmental control. So here what we do is we undress the patient and look for any possible injuries, and we prevent the hypothermia. Next, we have a topic that is known as the adjuncts of the primary survey. So what is meant by the adjuncts? Adjuncts of the primary survey. So what is meant by this? So adjuncts of the primary survey, it includes, there is a blood collection. There is blood collection. And the blood collection, it includes the CBC, the urea, the electrolytes. Then we also have the clotting screen, C-screen, and then we also have the glucose. Then the toxicology can be done, as well as a cross match. Then we have other findings such as the ECG, the pulse oximetry, then the ventilatory rate, then the capnography, as well as the ABG analysis. Next, what we have is the urinary and gastric catheters, urinary as well as the gastric catheters, and then we also have the EFAST. Now to recap what we did, there is the adjuncts, of the primary survey. This includes the blood collection, as we know the commonly it is the CBC or urea, electrolytes, then the C-screen. C-screen is nothing but the clotting screening, the glucose, the toxicology, as well as the cross matching is done. Then we also have the ECG, which is done, the pulse oximetry, then the ventilatory rate, then the capnography, as well as the ABG analysis. Then comes the urinary as well and the gastric, the urinary as well as the gastric catheters. Then comes the E-FIRST. Then lastly, in the adjuncts, what do we have? We are going to see it. So we also have the presence of the radiographs. There's presence of the radiographs, and radiographs of what? There's radiographs of the chest. Then comes the pelvis, are done as a part of the primary survey, preferably with the portable X-ray unit. So you basically prefer a X-ray unit which is portable. And when required, all these X-ray must be done on a pregnant woman. So it is also done in case of the pregnant woman, if indicated. Now, just to recap what we did, we saw the radiograph. So the radiograph is done for the chest as well as the pelvis, and most preferably we need the X-ray portable unit, and it is also done in case of pregnant women as indicated. Now we'll be answering our question. So the question we asked was, in brief, what are the steps which are involved in case of the ATLS? So the steps involved in ATLS are nothing but there is a primary survey, and there is also the secondary survey. Also there is a definitive care. So what about individually? So primary survey is with the simultaneous, along with the simultaneous resuscitation, and we also identify and treat what is killing the patient. So you identify what is killing the patient, Next, when you look at secondary survey, it proceeds to identify all other injuries. So identify other injuries. Then when we come to the definitive care, we develop a definitive management. So we develop a definitive management plan. So now, just to recap what we did, we asked the question about the steps involved in the ATLS, that is advanced trauma life support. So the primary survey, it includes along with the simultaneous resuscitation, we identify what is killing the patient. Then coming to secondary survey, we identify the other injuries which have occurred in the patient. And when we look at the definitive care, we develop a definitive management plan. So this was about the ATLS primary survey. To learn and grow daily, please do subscribe.